this distinguished group. I'm the administrator at Providence, Mount St. Vincent, and we are so happy to have all these representatives from public policy and family members and staff. So I think there's a special agenda planned. So thank you for coming and attending with us and getting ready to answer some questions. Thank you.
Thank you, Charlene. I just want to start by saying thank you to Providence, Mount St. Vincent for having us here. It's a little chilly. I just wanted to say that as well. So my name is Dr. Umair Shah. I'm the Secretary of Health for the great state of Washington, and I want to thank Ingrid Ulrey, our Health and Human Services Regional Administrator, who's here today, and her team, as well as other federal partners that are here today, other state partners who are here today, as well as AARP and Margarita Rowe, who is a dear friend from so many years, and it's just such a great for us to be here today. What we have been doing over this last hour was to spend time here at this facility that represents long-term care facilities across our state, and really to underscore the importance of protecting the residents ultimately, protecting the families who are here as part of the ecosystem, and also protecting the community at large. It is so critical that we continue to work together to be able to do that. And we can't do that without our staff, our teams, our people who are doing that very protection. And so I really want to thank medical director here, as well as the team here that are doing such an amazing job to continue to do everything they can to protect each other. We have been hearing the challenges of workforce, the challenges of what's happening with the triple-demic, the concerns around vaccinations, and we want to encourage everybody to get their bivalent booster, the COVID-19 booster as well if you haven't already, as well as getting your flu shot. We want to make sure that people are emphasizing that and certainly doing everything you can as community members, Washingtonians, to come together to protect people that are in facilities like this across our great state. Especially during the holidays, this is a very difficult, challenging time for residents. It's a very difficult, challenging time for staff members. And ultimately, we can't do that work unless all of us pitch in together. So please get your booster. Please, in appropriate settings, especially when it's indoor crowded, please wear your mask. Do what you can to protect yourself, get tested, and certainly making sure that if you're sick, you stay away from being in areas where you might unfortunately expose others. And so I do want to say thank you to Chris Robert for his father is here, and Chris is going to be speaking in just a bit. And it's so important for us to hear from people who have family members that are here, and that's what we just did in this last hour. So thank you so much. Now it's my great honor to introduce my colleague Ingrid Ulrey with HHS Region 10.
Thank you.
Thank you, Dr. Shaw. Thank you to the Mount, to everyone here who's supporting people as they age, supporting people with disabilities to live with dignity and respect. So again, I'm Ingrid Ulrey. I'm the Regional Director for the Federal Department of Health and Human Services. So I'm here today representing Javier Becerra, the Secretary of HHS. COVID is not the disruptive force that it used to be, but we are still losing 300 to 400 people per day. And 9 out of 10 of those deaths are among older people. And disproportionately represented there in those who are dying are people living in long-term care facilities. To date, we've lost a total of 161,000 people associated with living in nursing homes. So 2 things to everyone across the state of Washington. It's the holidays, right? So it's really important to show your love for your loved ones. We want you to visit and support people in visiting their loved ones living in long-term care facilities. But before you go, have the grace to make sure that you're up to date on your COVID vaccine. And think about taking a rapid test. Just make sure that you're not bringing anything you don't need to be bringing into the facility. The second is when you get there, and whether your mom or your spouse or just a dear friend is in an assisted living or a nursing home, check in with them. Ask them if they've received their latest updated bivalent COVID vaccine. It could save their life. If they haven't, support them, help them out. If appropriate, you could take them to the neighborhood pharmacy or just talk to the staff in the facility about the best way to make sure they're up to date. This is really important because we're not where we should be with vaccination in long-term care facilities. Nationally, only 47% of residents in long-term care facilities are up to date with the new vaccine, and only 22% of staff. To keep people safe this winter, the White House just last week issued the Winter Preparedness Plan. A couple of important things everyone should know about the plan. One is rapid tests, once again, are available for free, up to 4 tests. You can order them at covidtest.gov and get 4 free in the mail. So you can just take as highest precautions possible in situations such as visiting facilities like this. There was also a letter out to the governors supporting Governor Inslee as well as governors across our country with more outlining more resources and assistance to increase test to treat sites and bolster vaccinations. Also pushing out funding through our community health centers and through the Administration for Community Living out to the senior aging network and people living in community who are older and also very high risk. This plan included these key things and also encourages hospitals, before they're discharging people to facilities like the Mount, to please make sure they do their due diligence, that people are up to date before they're discharged to nursing homes. So it's the holiday season. It's a happy time for a lot of people. It's also can be a lonely time, especially for older people, people who don't have family to visit them. So please think of these things and take good caution as you spread your love to all of your loved ones, including people living in long-term care facilities. Thank you so much. I'm going to introduce Marguerite Rowe from AARP, wearing a red coat.
We're all wearing red. Good morning. I'm Marguerite Rowe. I'm the State Director of AARP Washington. We're a nonprofit, nonpartisan organization with a membership of nearly 900,000 in the state. AARP has been representing the needs and interests of older Americans for more than 60 years. And throughout the pandemic, AARP has been actively educating and updating older adults about what they need to know and how to stay safe. We've increased those efforts over the last month as we've seen the cases rise as we head into the winter and holiday months. I want to thank Providence Mount St. Vincent for hosting this briefing and for their efforts to stem the transmission of COVID, and for Dr. Shaw from the Washington Department of Health, who's been the ultimate public health champion in his work, and Ms. Albury from the Department of Health and Human Services for holding this important briefing on COVID-19 and staying safe this winter. Vaccines can greatly reduce the risk of disease and, more importantly, reduce the risk of severe illness. Yet data show that many are not up to date, particularly with the COVID boosters. AARP maintains a nursing home COVID-19 dashboard showing that in Washington, only half of nursing home residents are up to date on their vaccinations, and only a fifth of healthcare staff are up to date. As we move into the winter months where we're meeting more inside, it will take all of us to do what we can do to prevent the spread of COVID, flu, and RSV. This means that nursing home and long-term care residents, the providers and staff at these facilities, and friends, families, and caregivers need to do what they can do by getting vaccinated and by following the guidance and recommendations on vaccinations and ventilation. Just a reminder, in addition to being up to date on COVID vaccines, for older adults, it's critically important that they get their annual flu shots. Older adults are more prone to flu and its complications, and the flu vaccine reduces the risk of serious illness and hospitalization. As Ingrid has said, we've been reminded about the importance of social connections and being with loved ones. It's important that residents of nursing homes and other long-term care facilities remain connected with their friends and families. I'm planning on spending the holidays with my parents who are in their 80s, so I'm up to date on my COVID and flu vaccinations, and will be wearing my mask when I'm in crowded indoor areas. At AARP, we will continue to monitor the impacts of COVID, provide updated information as it becomes available, and advocate to assure that older adults have the information, resources, and services that they need. This year, AARP fought hard and is celebrating the passage of the Inflation Reduction Act, which includes the elimination of cost sharing for recommended vaccines for seniors on Medicare. You can find updated information for older adults on coronavirus, flu, and the Inflation Reduction Act by going to aarp.org. Thank you, happy holidays, and with this, let me turn it over to one of our critical partners, Pam Williams from the Long-Term Care Ombudsman.
Thank you, Mike. Hello, everyone. My name is Pamela Williams, and I am the Long-Term Care Ombudsman for King County. I just want to talk about what we do. Our program, we are a federal mandated program, and we are resident directed, and we're resident directed, and we are resident focused. Our role is to, we meet with the residents, and we try to help residents at all times. And the weeks that's leading into the Christmas and the New Year is the busiest time of all with the nursing homes. Residents are engaging in holiday events and receiving influx of visitors from families and friends. So it is highly recommended that everyone keeps a consistent communication channel open to address any fears from family members and concerns that affect our residents' safety. We definitely encourage physical distancing between families, and when they're having the group activities to reduce the risk of spreading COVID and the virus. The facilities have on-site testing, so when residents decide to go outside to visit their loved ones during the holidays, if they're gone for more than 24 hours, the facility can provide testing for COVID and upon their return. So if family members would like to have their loved ones out to visit, they can, but just remember that it's essential for them to have that testing when they get back to make sure everyone is safe. Our program is here 24 hours, and anytime you need our staff, we are available. We have volunteers to help, and the whole goal that we want to do is to always protect the residents and their loved ones during this special season so they can experience the joy of this most important holiday. And remember, the residents, they all have rights, and one of the rights is to be free of communicable diseases. So there are open communications between facilities and between the families and the staff. And I have a family member who will also speak on that, and this is Chris. Okay? Thank you.
Hello, my name is Chris Robert, and my parents live here at the Mount. They are Lionel and Olga. They live in assisted living. And I first want to say thank you to all of the staff here at Providence Mount St. Vincent who have kept my parents healthy during this challenging time. My parents are up to date on their flu vaccine and their COVID vaccines, as am I. This has been a really good reminder because I have children who are flying into town this week, and they are going to be excited to see their grandparents, and it's a reminder that I need to ask them, are you vaccinated? And to make sure that we are protecting my mom and dad by wearing our masks if we are indoors. It's a challenging time because we're tired of this, but I want to keep my parents safe, and I will do whatever I can to do that. And once again, thank you to everyone at the Mount. And I'm going to turn it over to Karen.
My name is Karen Goldenberg. I run our adult vaccine programs at King County Public Health. Like Chris, I want to keep our older family members safe too. Every member, every resident of King County is valuable, and the way we can all demonstrate that we believe that is by taking care of ourselves and then getting our vaccines. The bivalent booster is available very widely in the county. There's no shortage. Flu shots are also available, and we strongly encourage people to get both. As other folks have mentioned, keeping yourself masked when you're around more vulnerable family members, anybody who's older, that is essential. It's also essential that you think about wearing that mask whenever you're in a place where you might be exposed. It could be the grocery store, the drugstore, your workplace, wherever it is where you might be picking up bugs that you could then bring to a loved one. It's important. Wash your hands. That hand washing message you can't wash your hands too often. I know mine are chapped. Everybody else probably feeling it too. But that's an essential thing to do. When you are with people, thinking about your ventilation, could you keep your windows open? Everybody wear a sweater. That's a good way to keep the infection risk a little bit lower when you are together. And then if you are in King County and you know of folks who need to be vaccinated, please contact us. King County has resources. We can send mobile teams out to older adults who either live in their own homes and are unable to leave the home, or if you are aware of somebody who lives in a facility, in an adult family home or in a skilled nursing facility such as the Mount, please do get in touch with the county if you know somebody who is in need, and we will help make that happen. Thanks very much, and I think I'm going to send it back to Dr. Shaw.
Thank you so much to everybody that spoke today. I just want to, again, underscore the importance of all of us working together. And there are some side benefits of wearing a mask. As you know, oftentimes we're not wearing them outdoors for obvious reasons, but when it is freezing cold, this is the best thing to have on, because right now I feel so warm right inside my mask. I feel really good about that. But I just want to say, all seriousness, why it's so important right now that we continue to just emphasize the critical nature of our healthcare system and the surge that we're seeing. And the only way we're going to be able to get through this is if we all work together. And just cannot say enough about all the people that you just heard from. And I really want to thank again Ingrid Ulrey with Health and Human Services Region 10 for the incredible work that she and her team, as well as Renee Bouillon with HHS Region 10 do every single day to help work with partners like us at the state and at the local level. King County Public Health as well, Public Health Seattle, King County, and Marguerite Rowe as well, our continued admiration for the work that she does with AARP. Department of Health wants to emphasize to people to get your vaccines, get your COVID booster, get your flu shot. Please help us help people like all the people that you heard about from Chris and his parents and others who are in facilities like this. Help our health workers be able to be successful in the work that they do. And with that, I want to also just one last message is that you heard that the federal COVID test has reopened. We also have our state Say Yes to COVID test that also allows you to order up to 10 tests through the end of December, and then 5 tests starting in January, up to 5 tests starting in January. And so that program is also up and running. So this is the time that we want to make sure you have all the tools to be able to be healthy, safe, and protected. And we want to enjoy the holiday season. And so with that, we'll open up for a couple of quick questions if we have. If any of our reporters have a couple of quick questions, and then we will, I know it's cold, so we're going to try to end it pretty quickly, but go ahead.
It's nice to see you outside of a screen, by the way.
It is.
The tridemic coming up, do you see any particular dangers with that, either individual parts or in general?
Yeah, so the question about the triple-demic, the real concern that we have is flu season and the intersection with people who are getting infected with COVID-19 or RSV or other viruses or even other kinds of infections that are circulating in our communities. And this is why there are some basic prevention and safety activities that we can all put in place to be able to protect ourselves. Fortunately, it helps against each of those diseases, and that's why it's so critical for us to keep those steps in mind. But that is the concern that we have. We want to make sure that people get their flu shots in particular, as well as their COVID-19 booster. The flu shot, why? Because type A flu is absolutely circulating in the state of Washington, and much of what we're seeing in our healthcare surge is related to influenza, as well as RSV, and also contributions from COVID-19 and other diseases. So this is the time to continue. It's not too late. Get your flu shot, get your COVID bivalent booster, and make sure you take all the steps to help protect everybody in our communities.
Thank you.
What's the situation with resources? You've both mentioned the availability of tests, but I go to websites occasionally and I see, messaging and people mention that the COVID shots are no longer free, etc. What's currently being done or being proposed to keep for COVID a resource level high so that people can still access all these various things they need, tests and vaccines?
Thanks for that question. It's really about COVID resources, and those COVID resources are not as much as we had previously, and that's the reality, but we're doing everything we can to continue to support with COVID testing and obviously supplies and everything else that we can make available to our community members, as well as to our healthcare and partners in the healthcare system, as well as our local health jurisdictions. It's a very complex issue right now, and really we want to make sure that there is continued remembering that we are not completely out of this pandemic. We still have different phases, and one of those phases is that when you have a confluence of other diseases that are happening right now, as we're seeing with RSV and influenza, we want to make sure that those tools are available to Washingtonians. And the key message is that those tools are available, but we have to make sure that we're working together to make sure those resources are continuing to get to people where they are. And so with that, I'm going to turn it to Ingrid if she wants to make a comment about the federal pieces.
Well, thank you for that question, because having the appropriate level of resources that we need to continue to fight a pandemic that is still with us, as much as we wish it wasn't, is really important. Everyone should understand that Congress did not approve the administration's request for COVID funding. So we've had a significant reduction in resources at the federal level. That's why people saw the COVID test program for the federal free test paused. We were able to find some funding through the American Rescue Plan to re-up that as cases are rising. But for the long haul, and not just for our country, but globally, thinking about vaccination globally, it's really important that Congress pass funding to prepare not only to continue fighting this pandemic, but for pandemic preparedness for us. The funding is really important. I did mention we've had 2 bullets of funding that will be helpful. One through the Health Resources and Services Administration, HRSA, to the community health centers to re-up the kind of mobile clinics and that have been happening at earlier stages of the pandemic, get those going again now. And the other through the Administration for Community Living. I'm pointing at Louise Ryan there, our Region 10 administrator. That money is going to go to older adults living in community through our senior centers, through our aging network. So doing the best we can, but it's important that members of Congress truly understand this takes resources.
Thank you.
So with that, I want to say thank you again this holiday season. Please do whatever you can to help protect yourself, your loved ones, your community, and ultimately people who cannot always protect themselves. And so this is really an opportunity for us to work together. Thank you again for being here. And again, happy holidays to everyone.